Hey everyone, welcome back to the channel. Today, we're diving into a critical topic that affects thousands of people worldwide: colon cancer. We'll cover what it is, why it happens, available treatments, surgeries, medications, and side effects you should be aware of. Let's get started. Colon cancer, also known as colorectal cancer, begins in the large intestine, also called the colon, which is the final part of the digestive tract. This type of cancer typically starts as small, non-cancerous clumps of cells called polyps. Over time, these polyps can become cancerous if they aren't removed early. So, what causes colon cancer? While the exact reasons aren't always clear, several factors increase your risk age. Colon cancer is more common in people over 50. Diet. A diet high in red and processed meats can increase your risk. Family history. If colon cancer runs in your family, your risk is higher. Inflammatory bowel diseases. Conditions like Crohn's disease or ulcerative colitis can elevate the risk. Lifestyle factors. Lack of physical activity, smoking, and heavy alcohol consumption can also play a role. Some early signs to watch out for include changes in bowel habits like diarrhea or constipation, blood in the stool, persistent abdominal discomfort, fatigue, or unexplained weight loss. Remember, early detection can make a huge difference in the outcome. Colon cancer screening is recommended for people over 50 or earlier if you have a family history of the disease. The most common method is a colonoscopy, where a camera is used to examine the inside of your colon and remove any polyps that are found. Now let's talk about how colon cancer is treated. Treatment depends on the stage of cancer, but here are the main approaches. Surgery. This is often the first step. In early stages, surgeons can remove the cancerous polyps or sections of the colon. This could involve procedures like a colectomy or polypectomy. Chemotherapy. This involves the use of drugs to kill cancer cells, often after surgery to prevent recurrence. Radiation therapy. This is sometimes used to target cancer cells in specific areas, especially in more advanced cases. Targeted therapy. This treatment focuses on targeting specific proteins in cancer cells, blocking their growth. There are different types of surgeries depending on the location and extent of the cancer. Local excision. For early-stage cancers, a small section of the colon is removed. Colectomy. This involves removing part or all of the colon, depending on the spread of cancer. A colostomy bag may be needed temporarily or permanently. Laparoscopic surgery, a minimally invasive option where small incisions are made to remove the cancer. Medications used in the treatment of colon cancer often include chemotherapy drugs like fluorouracil, also known as 5-FU, capecitabine, irinotecan, and oxaliplatin. These drugs can be powerful but also come with side effects like nausea, fatigue, and lowered immunity. The treatments for colon cancer, while effective, come with potential side effects. For example, chemotherapy can cause hair loss, fatigue, digestive issues, and mouth sores. Radiation therapy may cause skin irritation or changes in bowel habits. It's important to discuss these with your doctor and find ways to manage them. While some risk factors like age and family history can't be changed, there are ways to lower your risk of colon cancer. Eat a balanced diet high in fruits, vegetables, and whole grains. Exercise regularly. Limit alcohol and quit smoking. And get screened regularly if you're over 50 or have a family history of colon cancer. Colon cancer is a serious but treatable disease, especially when caught early. If you notice any symptoms or are at risk, don't hesitate to talk to your doctor about screening. Remember, early detection saves lives. Thanks for watching, and don't forget to like, comment, and subscribe for more health and medical videos. Stay healthy, everyone.